We start off our show talking about the issue of gun violence. And Cure Violence Global is a not-for-profit organization that's aiming to reduce the spread of violence globally through a rigorous scientific as well as a data-driven approach. Now, the organization is guided by the understanding that violence is a health issue. Individuals and communities can transform themselves, as well as community partners and strategic partnerships that are actual keys to their success. We're pleased to have joining us the CEO of Cure Violence Global. We have Mr. Fredrick Echols joining us. And Fredrick, thank you so much for being with us. And as we talk about gun violence, of course, a lot of attention is placed on mass shootings. But the reality is, across America, we've got more and more shootings that aren't of mass proportion that we really have to deal with.
You're absolutely right. So unfortunately, a lot of the issues related to gun violence are focused on a few particular incidents. For example, you think about the type of media coverage that mass shootings get. It's disproportionate to the coverage that we get for shootings that happen on a daily basis. But when you really look at the details, mass shootings occur in most vulnerable communities on a daily basis. So you have these shootings and it's become a part of the norm. And so oftentimes media doesn't cover that as much as they'll cover some of the special mass shootings that occur. For example, the shooting that occurred in Uvalde, Texas, as well as Highland Park in Illinois. Those are special situations. But again, when we look at the reality, we know that mass shootings are occurring in some of our most vulnerable communities on a daily basis.
When we talk about mass shootings involved on a daily basis, a lot of people pay attention and find out that these are really sometimes inter-community struggles within the community, gang violence. We do have these random acts of shooting. But the truth is there's a lot of gang violence out there. And a lot of this happens within sometimes a 20 by 20 radius. Give me a little bit of insight as to what some of your research has turned up.
So what we're finding is that, individuals are more likely to engage in acts of violence if that's what they've been exposed to. And particularly when we look more deeply at the environment where those individuals are living, oftentimes those individuals are living in areas that are under-resourced. Areas where they have continued to suffer from significant disinvestment from local and even federal government, lack of job opportunities, low education attainment, and again, high levels of poverty. So when this situation occurs, you really have groups of individuals who are left to essentially fend for themselves without hope. And so when you have individuals who are left without hope, that really creates a situation, a dangerous situation. That's exactly what we're seeing across the country. So when we look at where the majority of shootings are occurring, these are in areas that I've just described. So high poverty areas that have suffered from decades of disinvestment. And so it's really important for us to look beyond just the individuals that are conducting the acts of violence, but really look at the environment where these individuals are living that helps facilitate or perpetuate the violence that we're seeing. And so part of the model that Cure Violence implements really allows us to remove the focus from the individual or certain populations. So we try to remove issues related to intersectionality, which helps removing issues related to intersectionality helps us really focus on the root cause of the issue. And so we have a three-pronged approach that we implement at Cure Violence. So one is we aim to interrupt violence. So either stop it before it starts, or in cases where a violent act has occurred, we reach out to those individuals who are the victims or even in the victims' network to prevent retaliation from occurring, because that's also a major issue that occurs across the United States. Retaliation occurs pretty frequently in neighborhoods across the country. And so by engaging those individuals who are the victims and their networks and really de-escalating the situation, we're able to prevent additional acts of violence from occurring. Second, we identify those individuals who are high risk for committing acts of violence. So one, we identify those individuals who may have a history of committing acts of violence, but we also don't limit ourselves to just looking at working with those individuals. We also have to be mindful of individuals who are living in our community who may have difficulty just managing the day-to-day stressors of life, right? So those individuals who may have difficulty paying their utility bills, individuals who maybe have difficulty putting food on their table, keeping a roof over their head, paying their car note, obtaining employment. those can be very difficult situations for individuals. And again, if the individual does not have hope, they're more likely to commit acts of violence. So working with those individuals, enrolling them in our case management program, and then connecting them to the resources that they need is really important. So if an individual needs, rent and mortgage assistance, connecting to organizations that can help them pay those bills. If an individual is food insecure, connecting them to organizations that can help provide food for them and their families. Those things are oftentimes taken for granted by a lot of people in our population. But again, that can be the tipping point for some individuals to engage in acts of violence. And then the third thing is, we want to change the community norms, change the social norms around violence, the perception of violence. And that is done through consistent and very intentional, culturally sensitive community engagement. We have to make sure we're engaging the community in a way that is meaningful for them. And so we really have to tailor, and that's one of the beautiful things about the Cure Violence model, is that we're able to tailor it to the community based on the community's needs, not based on what we perceive the community to need, right? And so that's one of the challenges with that I've experienced even with the government is, we have what we call Ivy Tower syndrome. So we'll develop programs, initiatives, and provide information on what we think the community need without allowing the community to actually let it inform us about their true needs. And so by working with individuals who are trusted messengers in the community, we're able to obtain that information and again, connect individuals to the resources that they need. And when we think about changing the social norms, we've seen this happen time and time again as well. So those individuals who are high risk, once they start getting connected to the services that they need, they'll start spreading the word to other people in their community. And so then what we'll start seeing is that those individuals who have a lower risk of actually committing acts of violence start taking advantage of the resources that are available in their community. And again, that's just part of the change in the social norm to prevent not only individuals from committing acts of violence, but we want to really change the trajectory of the entire community so that everyone in the community can have an opportunity to thrive.
When we talk about the community, obviously a lot of this is really dealt with community buy-in, because in order to have success, there's got to be this community buy-in. Talk to me about your programs and how you really work to get that community buy-in, so that way you can reach some of these, some of these people who are with the guns, and your violence interrupters can have an opportunity to really land safely.
So community buy-in is extremely important, and we achieve this by making sure that the people that we hire to represent the organization in communities are trusted messengers, so they have credibility in those communities. They're trusted individuals, and by having those individuals engage other people who are laypersons in the community, we're able to have a greater impact, and we're able to get the community to see not only are we investing in individual households, but we're investing in the community at large. And that has really given us a great return on the investment. And so when again, investing in people is really important. One of the things that we like to highlight is, the individuals who are deemed to be trusted messengers are oftentimes justice involved. And we pride ourselves by being able to give them a fair opportunity as well, because one of the challenges that I saw with working in government was oftentimes we would give individuals who are justice involved what I consider to be token opportunities, meaning that we're just checking a box saying that we hired someone who is justice involved. But then when we look more closely at that, most of the times those job opportunities do not provide livable wages. They do not provide access to mental and behavioral health services or employee benefits, medical and dental benefits. And so you're not really giving them an opportunity to thrive. And so one of the things that we are adamant about is making sure that, we do our very best to, one, remove the stigma associated with individuals who are justice involved. And we do our very best to make sure that they are paid a livable wage, given full benefits, so medical and dental benefits, and that they have access to mental and behavioral health services, so that they can have a true opportunity to have a good quality of life outside of the correctional system.
And when we talk about looking at the community, obviously you have your people who are really boots on the ground. The program is very successful. What do you find to be some of the strengths of what you're doing that's actually reaching people, having an impact, and actually making a difference?
I think the strength in what we're doing really comes from being able to hire the right people. As I mentioned before, a lot of the individuals who are the credible messengers and the trusted messengers in these communities are individuals who are justice involved. And so Again, working to remove stigma and give them a fair chance is really something that we pride ourselves on. But then when we look at the impact that we're having in community, it's really important to make sure that that information is documented. And so one of the things that we do across all of our sites is we have an onboarding program where we train individuals who are doing the work to do data entry. So we need to know the impact that the program is having. So we have a state-of-the-art database that captures over 250 metrics across each of the sites, and this information is being received by us daily, so we can see the impact that the program is having in communities, not only in the United States, but across the world. And as we tell our team, if it's not documented, it didn't happen. And so it's really important for us to be able to tell the true story about the impact of the program in communities, as well as advocate for evidence-based violence prevention programs at the local and national level. And the only way we can do that effectively is if we have data. And so data management and data collection and using proper techniques to analyze the data are really important to secure violence global. That's something that we pride ourselves on.
Well, when we talk about data, we know that you mentioned before that data really drives a lot of the success of what's going on. I've often had this conversation when it comes to really interrupting violence. To say that we broke up a fight, broke up a shooting, broke up, something drastic from happening and traumatic within our community. Sometimes those numbers really can't be counted for because it didn't happen, right? So how do you go about getting that message out to let people know, hey, we're successful?
So that's something that we do on a regular basis. So with every site that we have, we provide monthly reports to the sites, and so at least the sites that are utilizing the database, we provide monthly reports to the site, and this shows the hours spent conducting certain activities, the number of interruptions that occur, the number of hours spent helping communities with behavior and social norm change, as well as the number of individuals that are enrolled in case management and connected to resources. So all that information is captured. We also look at the risk vulnerability, do a risk vulnerability assessment where we're looking at the risk of individuals who are being connected into our case management program and monitoring them over time. And so that information is provided back to the local governments and the organizations that are conducting or implementing the cure violence model at the local level.
Share with me a little bit more about your violence interrupters. I know it's a trained program that you have, but these are the credible messengers, as you said, that really have that impact in the community. So share with us a little bit about how you work with them and the impact that they're having on the ground.
So we work really closely with them. So we help local organizations as they're trying to build the staff for their site or the workforce for their sites. We assist them with making sure that the right individuals are hired for the job. And so we know that violence interruption is a dangerous job, and it's a non-traditional job. And so you really need to make sure you're hiring the right individuals. And so we have essentially employment screenings that are done, and our team helps with that. And so we're able to help verify an individual's credibility in community. And so we do that before actually bringing an individual or recommending that an individual be hired at the local level. And this is, again, really important because you hire the wrong person. So you hire someone who does not have credibility in the community, because of the nature of this work, they could really be setting themselves up to get killed. And so we want to make sure that the right individual is hired, and the way we do that is, again, by working really closely with local governments and community-based organizations that are doing the work during the hiring process. So we make sure that we adhere to our protocols so that the individual's credibility can be verified on the front end, so that we can really set the program up for success. Then after the individuals are hired, we onboard them. So for a lot of individuals, this job opportunity would be the first structured job opportunity. So things like data management, timekeeping, those things can be really relatively new, especially considering that some of the individuals may have just gotten out of jail or prison. They may have spent 20, 30 years in prison or jail. And so we want to make sure we're setting them up for success as well. So we tailor our onboarding process to meet the needs of everyone in the room. So we want, even for those individuals who may have a 6th grade reading level, we want to make sure that they can comprehend what's been asked of them, as well as implement their duties in their scope of work at the greatest level of proficiency possible.
So for you, I know that you have the Violence Interrupters program, but then you also have a program that really deals with at the hospital, because we know that hospital scene can be quite traumatic. Many hospitals, maybe level 1 trauma hospitals, have pretty much induced that there is a lockdown at the hospital, but there are some resources that are available. And I know that you do a good job of really training people of dealing with the hospital. Share with us a little bit about that program.
So the hospital program is very similar to the community-based program, but we utilize the hospital staff to really connect individuals to other services. So connect them to case management, and also if the individuals are violence interrupters that are working in the hospital, they're able to obtain some additional information around the situation that had happened. And then once the individual is released, if they're released from the hospital, we can have proper follow-up when the individual is back out in the community. So we want we're able to kind of bridge the gap between the hospital and the community setting. And that's really important because we know that each system has its own limitation, but when the systems work together to meet the needs of an individual, that really helps the individual recover from the incident that occurred. It also sets them up for success beyond that particular incident.
These incidents happen too far, and I mean, almost too commonly. And when we talk about common incidents, the one thing that I really think about is that there are a lot of families that are impacted, not just on the side of the shooter, but also, well, I should say not on the side of the victim, but the shooter as well. And as a violence interrupter and those who are working with boots on the ground, what kind of resources are available to families of not just the victim, but I want to say also that shooter, because there may be a shooter's family and they may not necessarily be attached to that kind of lifestyle, but yet and still they need services as well.
Right, and that's the beauty of the program. So when we're thinking about connecting individuals to resources, it's not just limited to those individuals who are high risk. It's anyone who needs them. So if you, again, you need mortgage and rental assistance, if you need assistance getting food, if you need assistance with job skills training, assistance with obtaining employment, those resources are available to those individuals as well. The goal of the outreach workers and the violence interrupters is one to plant the seed that these resources are available, then help individuals get connected to those resources. One of the things that we've worked to do as well with some of the sites is to establish protocols so those individuals who are deemed to have the highest risk of committing an act of violence due to these issues are able to get connected in a more timely manner. And again, that helps us really operate with a sense of urgency to get those individuals connected as soon as possible.
In the future, as we are looking right now to really dealing with gun violence, and we know that there are new gun legislation laws and things of that nature, talk to us about what you're seeing moving forward, because we are seeing stricter gun laws, we are seeing stricter legislations when it comes to these guns, but I've often argued that the ones that are actually committing the crime really aren't paying attention to that. What are they paying attention to in order to be able to make that turn and put the guns down?
I think you're raising a really important point. So when we look at legislation related to guns and gun availability, oftentimes the individuals who are in communities aren't paying attention to that because that hasn't been a barrier for them. So I think for the law-abiding citizen, a lot of the gun laws can create additional steps for verification to make sure that they are sound and that their purchase of a gun is appropriate, right? But for the black market, those individuals, whether you have strict gun laws or loose gun laws, you're going to have those black market guns in your communities, and that's one of the things that we've seen. So even as the gun laws have gotten stricter, we've seen more and more black market guns in our communities, and so we have to really do a better job of working in community. And I think as you have for us to have credible messengers who can engage those individuals who may have those automatic assault rifles and they're only 14 or 13 years of age. That's a problem. But when we have the right people engaging individuals in our community who are high risk, we're able to have an impact that legislation may not be able to achieve.
How are you seeing the impact of gun violence across the United States from your perspective?
We're in a very dire situation right now. Particularly for African American men, aged 15 to 40, firearm-related violence is the #1 cause of death. And that's something that should not. I think one of the challenges is that we've heard this time and time again. We continue to see African American and other minority communities disproportionately impacted by gun violence and other types of violence. And so we have to really create the situation, or really create the narrative that this is not normal. And we have to get the communities involved so that they cannot accept this as normal, right? And so there's a lot of work that we have to do, not only at the local level, but the national level. And I think the stigma that has been attached to certain populations, and then the issues of intersectionality, issues related to systemic racism, continue to plague those communities. And so we have to really do a better job of advocating for Black and brown communities across the United States, and instilling resources in those communities. As I mentioned before, a lot of the communities where you see high levels of gun violence, they are stricken by poverty. They have been the subject of disinvestment for several decades. You have low education attainment, few job opportunities, a lack of access to quality health services, and in particular mental and behavioral health services as well. So there's a lot of work that we can do as a system to help improve the outcomes in those communities. But we have to really be adamant about pursuing social and health justice across all platforms. Until that happens, it's going to be a piecemeal process. So one of the things that Cure Violence Global is able to do is work with communities so that they can leverage resources that are already available, so that they can help those communities have a brighter future.
Dr. Echols, share with me a little bit about the United States versus the rest of the world, right? I think we hear a lot of conversation that's had when we talk about what goes on in the United States with gun violence. Our brothers and sisters across the world are looking like, this really isn't a big problem over here. But when we look at the United States, we often are left shaking our heads, because the access to and right to arms is something that a lot of countries really just struggle with, because when you compare the United States to other places around the world, this just doesn't happen.
So it's happening across the world. The Cure Violence Global has sites in other parts of the world. We have sites in Honduras, in Mexico, and Colombia. And every jurisdiction suffers from issues related to gun violence. The context may be a little different. And so that's, again, it's really important to be in tune with what's happening in the community and the community's needs, so that you can connect the community to the resources that they truly need, and not just what we think they need. And so by being able to tailor our program to the particular community where it's being implemented, we're able to have a greater impact. For example, in Camalacon, Honduras, years ago, people were not even comfortable being outside for prolonged periods of time because of the level of violence. But most recently, when we did a visit, they were celebrating youth and having a youth showcase, talent showcase in their community. And that is something that was never done before. But because we were able to meet the needs of the community by working with the community and hiring individuals who were trusted, incredible messengers, we were able to see a significant change, not only in the number of incidents of firearm-related violence, but also just the overall ability of a community to come together in a way that's safe for everyone.
So for people who want to be connected to the work, the movement, and how they can go about being a part, give us a little insight as to how one can participate in this.
Yeah, so everyone has a role to play in violence prevention. So, and that can start within the home, right? And so for parents, we encourage you to start having discussions about what firearm safety looks like, or what firearm safety is for you and your family. It's also important to talk about what firearm safety looks like on a national scale if you have those resources. So having discussions about that within the home is really important. Those are simple. That's a simple thing that individuals can do. Another simple thing that individuals can do is, if you have a gun or a firearm in your home, reach out to your local fire department, your local police department, or your local public health department to receive a gun lock, so their gun can be properly stored. That's another simple thing. Oftentimes what we're seeing more and more of is young individuals getting access to the guns because they aren't properly stored, and then you have accidental shootings that are resulting in unfortunate loss of life. And so properly storing a gun and making sure it's properly locked is really important. So those are two simple things, but you can also reach out to Cure Violence Global. You can reach out to us online at www.cvg.org. Again, that's www.cvg.org. And then if you want to get connected to us for more information about our program, if you're interested in learning about how to implement our model at your local level, you can reach out to us online as well.
Dr. Fredrick Echols, Cure Violence Global, thank you so much for being with us.
Thank you. My pleasure. Thanks for having me.
All righty. Well, we're going to take a quick break. We do have more guests coming up right after this here on the Social Justice Forums. Don't go anywhere.